and I'm afraid someone would take a picture and use it against me at a later date. It's got the long bill and the cover in the back and keep the sun off my face and my back. And
those are much needed when you start doing yard work at this advanced hairstyle.
They are anytime you're outside. And my peace and calm when I can do it is to fish. And so I enjoy not having sunburn when it's over.
Yep. There's a lot to be said for not having sunburn. All right. I think we're almost ready to go here. Yep. Got 1:15 straight up. So we'll go ahead and get going. So welcome everybody to our weekly briefing on all things COVID-19 at the City of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll start off with opening comments, as always, from Mayor John Hamilton.
Thanks very much. And Chuck, appreciate that, and welcome everybody. I think starting this week, it's just important to say we really see signs of concern. We try to lay out what we see going on, and right now we're not getting better. We are indeed backsliding measurably on progress against this pandemic. I have to say it's almost like we've seen this movie and we've seen some of the same mistakes before. I don't believe we should be loosening and relaxing at the state level while we're in this race between vaccines and variants. And right now, the race is not going as we want it. At the state level, both the positivity rate and the daily case averages are rising measurably in the last few weeks. Hospitalizations have gone from around 600 to now about 800. Deaths continue to be down, which is a very important and good indicator. Locally, we have some of those same trends, really, perhaps a little worse in some of the percentage changes in that. So we are not going the right direction, and it's really critical that we acknowledge that and that we take the steps that we need to do. We had 2 more city employees test positive this week. That means we're just about approaching 10% of our workforce having been diagnosed with positive cases, pretty similar to the national level, actually, overall. We know that vaccines are the long-term difference. That's hopefully the difference in the movie that we've seen before. And that's what's so important for the long term, and it's what we need more of. As I report each week now, we have 159 of our employees that have filed for the $100 wellness benefit. One of the advantages, besides, in my view, doing the right thing to help encourage people, it gives us some data on how many are applying for that. So we're up to 159, but that's a long way to go. I want to thank the Solid Waste District, which just yesterday adopted that same approach of a wellness bonus. The transit system, Bloomington Transit, is considering that. And look, it's vaccines are going to get us out of this, and I would encourage more employers to take steps, whatever they can, to increase the vaccine numbers among their affiliated populations. We're certainly looking at that, how to encourage and how to cajole or otherwise get more and more people to take the vaccine, because that's what's going to happen. Even requirements, if deemed appropriate in scope and time and manner and all, to do that. We have to be humble. The numbers, while they're not cataclysmic, we don't want them to be cataclysmic. We don't want to be in Michigan, and they're going the wrong direction. And we just have to say that straight up. And I appreciate the leadership of all the people on this call who are, I think, locally doing all the right things and all that we can. But we're not an island, and we have to keep our advocacy up and our partnerships up to encourage the right things to be done. So I'll be happy to take questions, and thanks again for all that everybody here is doing to try to protect us locally.
Okay, let's next go to get the view from Monroe County and Penny Caudill.
Good afternoon. Thanks, Mayor, for those remarks. I have what I want to say to you today, but something came across my desk yesterday that I really wanted to share. Our public health coordinator said that she was going through some emails from a year ago. So as of yesterday, 4/8, but think about 4/8/2020, and this is what she shared with me. A year ago this week, I was desperately seeking for PPE, and people from this county were scouring their closets and their garages to find random N95s or a box of gloves, and we were so thankful for it. We were trying to get cloth masks to cover the N95s medical professionals were wearing so they could extend the use of those masks. Local crafters were busy with making masks for us to drop off at fire departments and at the public health clinic. Much of the time, Ryan, who is actually one of our wastewater sanitarians, was running all over town, picking up and dropping off masks for the most vulnerable. Face shields often consisted of plastic bands that were 3D printed if we were lucky, and sometimes just a sheet protector attached to something to provide that barrier if we weren't lucky enough to, but could be creative. One email I had asked about 30 facilities for 8 unused face shields and was able to get 1 response. Simeon was pouring surface cleaner out of huge containers for me to give to local long-term care facilities because they lacked cleaning solutions. Nearly every long-term care, assisted living, home health, and both hospitals came to us for PPE, many on a weekly basis. This went on for months as their normal suppliers could not fulfill orders. It's hard to even remember how bad it was and how desperate she felt. We have come so far. You know, Allison and Kate were out there picking up those masks and distributing all that PPE, and she still goes on those runs for PPE and mask delivery and different things. We want to keep moving forward. We can by standing and continuing our prevention measures, getting vaccinated so that we can come out on the other side of this pandemic. The mayor mentioned this, and it's true. Cases have been rising. We hope that we are starting to see a plateau, but it is way too early for us to say that's actually happening. Our rolling daily average number of cases has topped 30 per day. Our cases per 100,000 is at 137 this past week. And while our positivity rate is still low, it is growing, and today is at 1.1%. So it is with that the Board of Health met this week. We are, as we've said last week, maintaining our regulations. Masking and distancing will remain in place. This current order is effective through May 28th, unless rescinded or extended prior to that time. So we like to have that glimmer of hope. We feel that we can see that light at the end of the tunnel if we continue our prevention measures. So we have a goal date, and I ask everybody to help us meet that goal by doing absolutely everything you can, including being vaccinated as soon as you can, and in terms of wearing your masks and continuing all those measures. Our gathering size limits will remain at 50 in the county, and that includes social and commercial events. 15-person limit for social gatherings remains in the city limits. We did make one change to retail food establishments, and this really came because it was a difference that had been in the state requirement. So businesses that have back-to-back booths seated may use a barrier in place of space if they are able to do that. So that was one small change that we made in the regulation for our community. We did make some small residential communal living regulation changes. One is to allow for an exemption process for houses that have live-in members who are fully vaccinated, that they may increase their capacity as long as they still have isolation and quarantine space. So with vaccinations being available, we feel that that is a reasonable offer as well. It is an exemption process. It's not an automatic, and they may have up to 15 people gathered outside that could include guests. Whereas up to now, there have not been allowed to have any guests on the property. So those two small changes, we did go with that 15 of the city limit. We didn't want to confuse that anymore and to maintain that small number. In terms of vaccinations, over 28,000 people in Monroe County have been fully vaccinated, and that accounts for about 22% of our eligible residents. So people who are 16 years and over 44,000 people have received their first dose of vaccine, and that accounts for about 34%. Remember that our goal is to be well over 75%. So a minimum would be 75%. You know, we would love to see it at 95 or 100. That's highly unusual for any vaccine, but we still have a ways to go, but we have done all of this in 4 months' time. The state has over 1.3 million people fully vaccinated and over 3 million people who have received their first dose. So we've done a lot in a short amount of time, but we have to continue to do what we're doing. Retail pharmacy program continues to grow. Currently, the state has 17,000 pharmacies nationwide. I said the state, but that retail pharmacy program. And in the next 3 to 4 weeks, they expect that to grow to over 40,000 pharmacies nationwide. So all of that helps get the vaccine in more accessible to our residents. We continue to do the homebound program, and we continue to get positive remarks. We get regular feedback from those residents thanking the fire department and our staff for going out and giving them that vaccine. As all of these vaccination clinics expand, we could use more vaccinators to volunteer. So we have a large pool of volunteers, but certainly vaccinators are becoming harder to find to cover everything that we need. So I would encourage anyone who's out there, a retired nurse or someone who meets eligibility to vaccinate, who's been thinking, oh, I could possibly volunteer. Now's the time to step up and help us get to that finish line. And the last thing that I would say in terms of the dashboard, there are some more color-coded things. So the vaccine map is now color-coded by vaccine. So you can look for that, you know, if you are 16 and you need Pfizer, you can look for that on that map because it's now color coded. And the population information is also on the vaccine site. And that's what I have for you today, Chuck, and I'll be happy to answer questions later.
Okay, let's next check in with the Monroe County Board of Commissioners and Lee Jones.
Penny, thank you so much for reminding us how far we actually have come in a year. And while things may still seem difficult, we are better off than we were. Kind of reassuring to think about that. I wanted to say that the county is continuing to give out CARES grants, grants that are funded with CARES money. We will continue to take applications until the end of April, which looks like it may be good timing because probably the American Rescue Plan will be kicking in just about then. These are grants, not loans. You do not need to repay them. And so far, between the CARES and government grants, the county has given out $678,930.31. So we're very pleased to have been able to help that many people like that. The commissioners and the council work together to get extra funding to the townships. The township trustees are the people who can help out residents if they need it, in particular for necessities such as rent or mortgage payments or food, paying utilities, all of that kind of thing. So if you're having problems, please contact your township trustee. Everyone in Monroe County, including everyone who lives in the city, does have a township trustee. And you can find who it is by going to the county website, which is co.monroe.in.us. And it's on the emergency management page. And so far, we have given out $80,683 to the township trustees, and 148 households have been helped. So this has really been a pretty worthwhile program. Thank you.
Okay, let's check in with the Monroe County Emergency Management Director, Allison Moore.
Thanks, Chuck, and good afternoon. It is exciting to see where we've come and how we continue to go, and to remind everybody that it takes us all. It takes just wear those masks, social distance yourselves. Even when you're in those small gatherings, it often just seems like, oh, we're all wanting to be done with COVID and live this new normal, whatever that might be. And we need to remember that it takes all of us doing our part. But it is exciting to look back and to see how we've come, and the beginning initiatives that we put in place and how some of those have continued to remain. Just this morning, we were able to drop off another 2,500 masks to a department that needed several masks for something. And we will continue to be able to provide for our public safety providers and shuffle all that PPE around. And so we are fortunate that we get to be the hub for that and continue so that we can remain and continue to make sure that we're wearing proper PPE and that we can provide it for those that offer services to our community. We have 2 blood drives in April, and I'm starting to get a little worried because we have been very fortunate that every drive we've had, every spot has been able to be filled, and we only have 8 spots filled for April 29th. So if that date works for you and you can make an appointment to make that donation, I would encourage you to do so by going to the redcross.org website and making a donation. We also have a drive scheduled on the 30th. We have that date almost filled. So I'm not as concerned about that date, but if that date works better for you, rightfully so, you can register the same way. And we have our dates scheduled out now through August. And so you can go to our county website to see those dates and see if you find one that's available for you in your schedule. Again, I encourage you, if the 29th of April works for you, to make an appointment so that we can continue to fill all of those spots for our blood drives. And I appreciate all those individuals that have been able to make those donations for us in the past and will continue to do so in the future. And Chuck, that's all I have today. Thank you.
Okay, let's go to IU Health and Brian Shockney.
Thank you, Chuck. We've seen a concerning increase, as the mayor said, in COVID-19 inpatients over the last week. The increased volume is the largest we've seen in over a month. And as you can see on the graph, we are going in the wrong direction with hospitalizations due to COVID-19. We're also seeing a rise in our ICU census. As of Wednesday, our IU Health ICUs statewide were 88% occupied, and regionally, our IU Health ICUs were 75% occupied. We continue to manage very well, and we're caring for the patients, as the numbers of these patients are not as high as they were in the pandemic, and the height of the pandemic or the surges, but we are seeing this trend that we've seen prior to a surge occur recently. With the recent uptick in inpatient cases, we're also seeing a trend in younger individuals making up the majority of the COVID cases. This is likely tied to our wisdom generation being eligible and receiving the vaccine at a high percentage over the last few months. So where over 80% of our patients were 65 and older during the past year, we now have over 70% of our patients below the age of 65, with a spike in the 25 to 34-year-olds over the past 2 weeks. The most recent data from Johns Hopkins and CDC showed that our 7-day average of new cases is at the same level it was in July of 2020, both for Indiana and for the US. This represents a 26% increase in cases in Indiana and a 20% increase in cases in the US. At the same time, our hospitalizations are up over 18% in Indiana and 2% nationwide. Please continue to wear your mask, social distance, and stick with us in this pandemic mitigation for the remainder of the pandemic until it is declared over. The good news, as of yesterday, between our Bloomington and Paoli vaccine sites, we have vaccinated over 66,830 individuals. At our Bloomington site alone, we have vaccinated 49,378 of the 51,620 vaccines we've received for a 95.66% utilization. So to date, over 70% of our IU Health team members in the South Central region have received their vaccine, and we are proud and grateful for those team members that continue to make the choice to become vaccinated. To show the effectiveness of vaccines, to date, less than 10 team members in the IU Health South Central region are currently in quarantine. Our quarantine numbers are currently the lowest we've experienced since the pandemic of the 5,000 total employees we have in this region. And this speaks to the impact and the effect of vaccines and following the best practices to prevent the spread of the virus. This fight isn't over. I'd like everyone to take a step back, think about how you're protecting yourself and how you're protecting your loved ones. What more can you do? The most important things you can do is wear a mask, physically distance from those outside of your household, and practice regular hand washing and sanitizing until we can get, as Penny said, over 75% of our community, family, friends, and citizens vaccinated. I also would be remiss if I didn't bring to your attention and share my ongoing concerns about the woeful funding of public health in Indiana. This pandemic has clearly shown a light on the stressing of our health departments, healthcare services, and government agencies. In addition, the vaccination process has been very dependent on hospitals, pharmacies, and others, which has further stressed the capabilities to provide healthcare outside of COVID-19. The federal ACA dollars have been a godsend for all of us. However, it's the future of public health and how we go forward once this pandemic is over that is of great concern. According to the Trust of American Health, Indiana is currently 6th from the bottom of the list of U.S. states in our funding of public health. It's good that since 2005, Indiana has increased its spending from $11 per person to $15 per person in 2019. However, we are still behind the curve in both percentage of increase and dollars invested in our health and our future. Meanwhile, we are one of the least healthiest states, 9th worst in smoking and tobacco use, and 7th worst in physical activity, and 10th worst in obesity. We are disappointed in the tobacco tax being pulled from the budget bill in the Indiana Senate, as we know the direct relationship to this reducing smoking, specifically in our younger populations. There is support for a vaping tax going forward with the state legislature, which is a step in the right direction. COVID-19 attacks our pulmonary system, specifically our lungs, among our other organs in our body. Poor lung function exacerbates the effects of COVID-19. So while hospitals and community service organizations are doing their part to help move the dial on these public health metrics, such as robust partnerships with Monroe County Health Department, IU Health, are millions of dollars invested in wellness education and training for elementary students to seniors, this is not something we can do alone. Our elected state officials must act. We must have serious discussions regarding enhanced public health funding and ensuring local public health leaders have the ability to make decisions of any health crisis or issues as they have the expertise and frontline understanding of the issues. Some of you might think this is not related to the pandemic and what I've just said, but you would be remiss in thinking so. We all own the health of our community, and we are a state and country that no matter what our politics, look to those government, quasi-government, and community agencies for solutions and support for the best future for our citizens. We must see this pandemic and the gaps it has highlighted as an opportunity to act now for our future. We truly are in this together. And I'll end with a quote that I think we all can take some learning from. It's from an anonymous person, and it says, "Be bold. Do what the ordinary fear." Thank you, and I'll take questions at the end.
All right, thanks very much, Brian. Let's next check in at IU and Kirk White.
Good afternoon, everybody, and I appreciate all the updates from all of our agencies and departments today. It's good to hear both positive and negative. It keeps us on track. And along those lines, I'll start with the numbers at the Bloomington campus for the last couple of weeks. You might know last week we tested through our normal mitigation testing process 22,000 tests. And as I mentioned last week, we were seeing an uptick in the prevalence rate. And that did hold true through the end of last week, but the prevalence rate ended up at 0.4%, and the mitigation testing rate was at 0.5, which bumped up a couple of tenths from where we had been. This week, our numbers are looking a bit better. We've tested 13,000 so far with reporting. We've still got more reporting to come in and more tests to do today, but the trends are back to where they were a couple of weeks ago. So perhaps we're past that post-spring break bump that we saw, and the ones related to some of the other activities that were going on. So a little better news from the campus this week, and I'm glad to see that trend. On the vaccination front, this has been a very busy week for us. We're running our vaccine clinic at Simon Scott Assembly Hall a full 6 days this week. And by the time we get done, we will have vaccinated over 7,000 people this week. And that will continue on. We expect and continue the upward trend with that. We're very thankful for the additional supplies that the state has sent us, which has allowed us to go full speed in our both open pod, where we have community members coming to the campus, as well as a special amount of time that we're vaccinating our students, faculty, and staff, as directed with these additional vaccine supplies from the state. So we want one very important point here is what we're seeing is as more vaccine sites and appointments are available, people may find a new one, perhaps at our location or at another location, and they do not cancel their old appointment. And so what that's causing is uneven supplies. We may prepare more than we need for a particular block of time through the pharmacy process with the liquid vaccine as it comes. So I want to encourage everybody, if you want to change your appointment, get on the phone, call 211 and get a hold of a representative that can pull up your record and change your appointment. Cancel your old one if you've got another one made. This will help the whole system and the various suppliers around the state. They're all having this issue. So please do that. I know it's not the easiest thing, but we're using systems that weren't exactly designed for all this, and doing our best to make it happen. So keep up the good work. Though we've seen some upward trends around the state, I think what we're concerned about the most is the increasing number of the variants that have made it to Indiana. We know that is the case. The reason that we're concerned about that is those who think that they may be in good shape because they had COVID perhaps last fall don't have the same immunity to new variants this spring. So the vaccine is going to help you, but if you're not vaccinated yet, or if you're not quite sure, or if you think you're okay, probably not. So with these variants comes additional risk. The vaccines are going to help us, but let's remain vigilant and keep up what we need to do. Thank you.
Okay, thanks, Kirk. Our first question from Dave Askins, the B Square Beacon. This goes to Penny Caudle, and he asks, are you able to say anything about spring break travel as part of the mix for this recent upsurge? Is contact tracing confirming spring break travel as the source of infections?
We certainly are getting some reports. There's not a specific number of where families, for example, have traveled. Individuals from the same households have traveled and come back and tested positive. So we have seen some of that in talking to various people who do some of the contact tracing, that is certainly most likely part of what we are seeing in some of these numbers.
This question for Kirk White or Penny, also from Dave. Based on the minimum time between doses, have we not yet started to see the impact of the IU facility on our fully vaccinated numbers? Even without the boost from IU's facility, Monroe County's rolling average of fully vaccinated people has increased from the low 300s to about 500 per day. And the question here, what accounts for the increase in the per day fully vaccinated people in the last 2 weeks?
So what I would say is one thing that's been affecting this certainly is the number of vaccination opportunities across the state. The vaccination clinics with Johnson & Johnson, which is 1 dose. So you don't have that 2-week lag to be fully vaccinated. That makes a difference for somebody for those numbers to go up quickly. And certainly the state has put a lot of effort into having some large vaccine clinics using the Johnson & Johnson. But we do continue to see increases. And again, we are continually building opportunities. We received a little more vaccine, opened up some appointments at the convention center, continue to do outreach, and all of those things play a big part in getting everybody vaccinated.
Yeah, and Chuck, I just add, Penny, I think you're exactly right. Brian can back us up here. A lot of Monroe County people in the first phases of the vaccine rollout, there just weren't enough vaccine appointments available in Monroe County, and many people went to our surrounding counties to get vaccinated, which all goes into the state database, which shows our numbers going up, but it's because they probably got it someplace else. Many people in Monroe County felt comfortable going to the IU Health site at IU Health Paoli Hospital, for example. Many others went to the first Speedway site in Indianapolis a few weeks ago. Those, as Penny mentioned, the J&J, you get that fully effect within 2 weeks. In our case, with what we started at Assembly Hall, it's going to be 2 weeks after your second dose. And so that's going to be around the 1st of May for some of our people, and maybe even finals week before they actually have the full benefit of a second Pfizer dose. Chuck, you went.
There you go.
There you go.
Trying desperately to unmute, and they wouldn't unmute for me here. They got to oil my Zoom. So I think that we answered the second question, when we're expecting to see the positive impact on our fully vaccinated numbers with that second dose given at the IU facility. Kirk, I wonder if you might elaborate a bit on those numbers there. I know that we've made a push to the IU community for getting people into more slots that we've opened up for them in addition to that open pod.
Yes, that's right. So we started last week with the open pod. So of course that was the week of the 29th. This week we started with both open and closed. We'll continue both the open and closed into next week as well. So as I mentioned, you get scheduled 3 weeks after your first Pfizer dose or the second dose. And then 2 weeks after the second dose is when you're considered fully protected. And that's a really important point. I'm glad that Dave raised it. We don't consider you fully protected until that 2 weeks after the second dose at IU. So you're going to stay in the mitigation testing pool for that full time until 2 weeks after your second dose. So those who have it has 2 weeks have elapsed since their second dose of Pfizer or Moderna, or their first or their one and only dose of J&J, they are considered fully vaccinated, and we pull them from the mitigation testing pool at that point.
A question from Hugh Pebworth at the IDS. And I've frozen up. You guys hearing me? I froze up for a moment on my end. I couldn't tell
You're
if you were
good,
hearing me
yeah.
or not. So I take it you are. Okay, good. From Hugh Pebworth at the IDS for Penny, does the county plan to release any stats on the numbers of cases categorized by different variants?
Well, at some point, we will certainly have that information that we can share. Keep in mind that typically what happens with any kind of infection that numbers under 5 are usually suppressed. So the state will hang on to that information until a county reaches that level, and then that would likely be released. That has to do with confidentiality reasons. But I would say this in relation to that, because we see this lots of times with other things, and that is, keep in mind that not every specimen is checked for the variant. It's part of kind of a surveillance program to see what's circulating. So when numbers are reported, and so for example, that we know that in Indiana, the UK strain, we've had at least 250 cases, and the California variant, at least 40 cases, but it is at least that. And what this information really tells us is that we have these variants circulating. And so whether there is 5 cases or 10 cases, we know that they are circulating in our community, and we know these variants are more easily spread. Transmission is easier.
Okay. We'll hang on here a second, see if there are any more questions. No new ones in the chat, but I'll wait just a moment, and I'll do my plug as I do this. If you want to find out more about COVID at IU, you can go to our website at covid.iu.edu, and that is where we also have information about the vaccine location at IU as well. So going once and twice here, we still have a few minutes, so I hate to give up if we do have some questions out there, but I will give it just a second here more. But I'm not seeing any more questions here, so I will go ahead and close it there. We will return again next week at 1:15 for our update on COVID-19. Thanks everybody for your questions and your attendance today.